6 years after COVID-19 upended the world and killed more than 1 million Americans, the political fight there over what happened and why is back. And public health experts are asking, what lasting damage is this reckoning doing? Right now, Republicans in Washington have Dr Anthony Fauci in their sights, the most recognisable face of America's pandemic response. On Thursday, a Senate committee voted to hold Fauci in contempt of Congress and refer him to the Justice Department for potential prosecution over his refusal to answer questions at a hearing last week. Republican Rand Paul subpoenaed Fauci to force last week's appearance in Washington, accusing him of lying about the origins of COVID-19. Paul is a vocal proponent of the theory that it originated from high-risk research in a Chinese lab. Since the early days of the pandemic, Fauci and many other scientists have contended that the virus jumped from an animal to people naturally. Neither theory has been definitively proven. Well, Fauci spent decades as the top US official for infectious diseases, advising 7 presidents. During the pandemic, he faced death threats over the restrictions he championed, like lockdowns, mask mandates and social distancing, as well as vaccines. And he later clashed with President Donald Trump over the government's response to the pandemic. Last week, he invoked his constitutional right to silence more than 100 times. Take a listen.
Under the advice of my attorneys, I will invoke my right under the Fifth Amendment of the Constitution to refrain from answering your questions.
Can you explain to the committee why you chose to fund this dangerous research in China?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment of the Constitution. On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment of the Constitution.
Let the record record that the witness has refused to answer whether there's a folder in front of him based on his Fifth Amendment right.
Let's cross to Washington, D.C. now and speak to DW correspondent Misha Komodovsky. Misha, the Senate committee has voted to hold Dr Fauci in contempt of Congress. Can you just unpack this for us? What does it mean?
Well, Jared, so here's what just happened. The Senate Homeland Security Committee voted to hold Dr. Anthony Fauci, as you said, in contempt of Congress. That's, as we remember, the former top COVID health official, and has been in Republicans' crosshairs for years now. This all traces back to a hearing last week where Dr. Fauci was called to testify on the Hill, but refused to answer most questions. He invoked his Fifth Amendment right, and he was upfront about why. He said in his opening remarks, in his opening statement, that he believed Republicans wanted his testimony so that they could prosecute him. And Fauci was testifying about the origins of COVID-19 and coronavirus, on whether he misled Congress about it. And some Republicans have long said that COVID may have started from a lab leak in Wuhan in China, and they think U.S. tax money may have helped pay for that research. It was a heated exchange on the Hill in the hearing room last week, again with Fauci pleading the Fifth, as we say it here, and now Republicans took the next step. The vote was 8-5, straight along party lines.
And as I understand, Misha, Fauci received a preemptive pardon from the former US President Joe Biden. So what does this mean for him right now?
Well, first of all, it doesn't mean that he's going to jail. Dr. Fauci could now face a criminal referral to the Justice Department of the United States for refusing to cooperate. It's not a conviction. Senator Rand Paul is sending this contempt finding straight to the Justice Department, specifically to Jeanine Pirro, the U.S. attorney here in Washington, D.C., and then she decides whether to even pursue charges. And even if Pirro wants to prosecute him, she would need a grand jury in D.C. to agree there is a case. And let's remember, former President Joe Biden, as you said, gave Fauci a pardon covering everything from 2014 through January 2025 that protect him from most COVID-era conduct, but not from anything Republicans argue happened during this very recent testimony. So this moves from a tense hearing from this hearing room to a real possibility of legal consequences for Dr. Fauci. But again, he's not going to jail yet.
That's an important point you make, in that a contempt referral is an accusation but not a conviction. Now, this is the Homeland Security Committee. Tell us, Misha, why is it holding hearings into the pandemic?
Well, first of all, Jared, this committee has no power to punish Dr. Fauci. All it can do is, as you said, refer this to the Justice Department, and then prosecutors, not senators, ultimately decide if this goes any further. And when people hear Homeland Security, they immediately think border, or they immediately think terrorism. But this committee is actually the Senate's main oversight arm. It can investigate almost anything about how the government has been run, including the pandemic response that Fauci was responsible for. And its chairman, Rand Paul, has unique power to issue subpoenas without even needing the committee to vote. That's how he got Fauci, Dr. Fauci, in that chair.
Misha, you mentioned Rand Paul, the committee chair. Let's listen to something he had to say today, and we'll come back to you.
The chair directed Anthony Fauci to answer. He refused again. That is what we are voting on today. Not his opinions, not his policies, not anything he said from a podium 6 years ago. We are voting on whether a witness who has received the benefit of a sweeping federal pardon can be ordered by this committee to answer questions and then defy that order without consequence.
Misha, Rand Paul saying there that this is about Dr. Fauci declining to answer questions last week, not his pandemic decisions. But there is a lot of speculation that this whole situation has been driven by a personal feud from Rand Paul towards Dr. Fauci. What can you tell us about that?
Well, Jared, it's fair to say that Senator Paul's personal history with Dr. Fauci runs deep, and even Fauci himself has publicly accused Paul of, and let me quote here, of having an unhinged obsession with him. But Senator Paul built his legal argument simply. He says Fauci's pardon means he had no right to plead the Fifth during that hearing.
That was DW's Misha Komodovsky in Washington for us. Misha, thank you so much. So what effect could these proceedings have on public health in the US? Dr Owais Durrani is an emergency medicine physician and medical analyst in Houston, Texas. Great to see you. Just tell us, what are your thoughts, firstly, on Dr Fauci being held in contempt of Congress?
Yeah, my initial thought would be, I think it's a sad day for public health in America. You know, I think to the young, person who maybe is going to medical school or wanting to get a PhD, or maybe they're in that process, and maybe they want to go down that route of public service like Dr. Fauci did. And this is the example for them, right? They may make it through all those steps, be able to meet those challenges and do the best that they can in that moment, which is what all of us do in healthcare. And then one day they may be kind of brought in front of the US Senate and held in contempt and, threatened with jail time, which is terrifying. And so that's where my mind kind of goes to first, for a man that, has dedicated his life to public service, who helped us fight so many battles, including the AIDS crisis in the 80s, and obviously this once in a generation pandemic. And it just unfortunately sets a bad example for those that we are trying to recruit into this very tough field.
Owais, we spoke to a political scientist here last week, and I'm going to summarise basically what he said. And he said basically that this did appear to be political point scoring in some form, these proceedings in Washington, but also that the wounds and the grievances from COVID hadn't really healed in the US, and that it was appropriate, in his view, to revisit decisions that were in some instances heavy-handed and did unnecessarily restrict people's freedoms. What's your response to that?
Yeah, I would agree, right? In the scientific process and in medicine and in science, we always, look for what we did and was it right? Was it not right? Did what the actions we took were the answers to those actions what we expected? And if they weren't, then we kind of analyze that and correct for future experiments, or in this case, a future pandemic. I agree that we haven't healed from the pandemic. There's a lot of mistrust within healthcare that has increased over the last few years. Unfortunately, things like, vaccine hesitancy or violence against healthcare workers, those things are on the rise. So obviously there is something that we have to deal with, and we have to deal with it because there's going to be another pandemic or another crisis where we're all going to have to come together. But how we deal with it is obviously in a bipartisan way, in an objective way, where we can learn from those things and then take those lessons and hopefully do better next time, rather than trying to assign all of the blame on a person or a set of people, just for, like you mentioned, that political science scientists said, political points.
But Republicans would argue that they have a right to scrutinise the decisions that were made, and particularly the people that made them, and that's what they're doing in these proceedings.
Yeah, no, they do have that right. We all have that right. I'll give you an example, right? In healthcare, in the hospital, when a unexpected death happens or an unexpected outcome, we have what we call morbidity and mortality conference. It's where all the clinicians involved in that patient's care, the nurses, admin, all sit down and no one gets punished. Everyone kind of gives their perspective of what happened, why they maybe gave a certain medication or did a certain procedure. And then there's a discussion around, hey, maybe that shouldn't have been done. Maybe it should have been done a different way. Everyone leaves there learning something. And once again, no one's punished. You don't get a strike against you or anything like that. That's what we need to do here, where, we have a conversation. Was everything done perfectly? No, but it wasn't done perfectly in any country. This was, once again, a once in a generation type situation. And so mistakes were made. We need to learn from those mistakes, but we have to do it in a way where that discussion happens rather than, something that's a made for TV event.
Right. Now, I would just like to gauge from your point of view what the pandemic has done to trust broadly in public health in the United States.
Yeah, so broadly, if you look at the polls that are done every year in terms of, what's the most trusted profession and your level of trust in healthcare, those numbers have come down. They're still, in a place where, healthcare still is a trusted profession, but they've come down over the last 6 years. That in turn leads to other downstream effects, right? It may lead to people not coming for their yearly physical and missing diagnoses that could have been caught earlier. It leads to things like, vaccine hesitancy, where measles is at a multi-decade high. It leads to things like violence against healthcare workers, because some people believe that maybe we don't have their best interest. And when, someone is in the ER, maybe interacting with a healthcare worker for the first time in a few years, and you say something in terms of a treatment plan or whatnot, they don't like it, and things unfortunately go south. And so it is a problem I see on a daily basis. And then on a broader picture, it's something where when you go to a healthcare conference, my colleagues talk about this frequently as well. And so it definitely is a problem, and we have to figure out how to fix it, because, when that trust goes down, it harms all of us, unfortunately.
And on top of that, the pandemic also saw a huge amount of misinformation being spread around. Has anything changed since then?
It's gone worse. There's a frequently cited number where, if you share something that is misinformation or bad information, it spreads 6 times more quicker than the truth and facts. And we see that every day, right? We see it, once again, I keep bringing up vaccines, but that's something that we're dealing with on a day-to-day basis here. But we see it where people try fad diets, where maybe they don't want to take a certain medication for, say, diabetes. This is something I saw personally, where they wanted to, take advice of a TikTok influencers, and unfortunately they showed up in a very decompensated state, had to go to the ICU. And so we see the results of that misinformation spreading on the ground very rapidly. And that trust factor does come in, right? If you don't trust the healthcare system and your doctor, you're going to turn that attention and that belief to somewhere else. And unfortunately, that has been social media in a lot of cases, and people believing things. And there's multiple things, right? AI is kind of speeding it up as well. There's AI fake influencer physicians that you can't tell if they're a real physician or a AI version of one that people take advice from. And it's unfortunately all just adding the fuel to the fire that we have right now.
And what are some of the solutions to this, to counter this misinformation that you've just outlined?
Yeah, so the solution to drowning out the bad information is to get more good information out there. And it's a hard answer, right? The easy thing to say is, hey, clinicians need to be on social media. They need to be where people exist. The downside to that is I create a lot of social media public health content, but then I will get personally attacked. I get DMs that are not so pleasant and whatnot. And, I have a thick skin, but, people may not want to deal with that. And I don't blame them. I think we need to get to a place where healthcare and science, once again, is a nonpartisan issue where, it's built to help everyone, not to get anyone. And we need to find that consensus. I wish I had the exact answer to that because it is going to be a tall order to get back to that place, but we have to. There's no other option.
What are some of the lessons that the world, and particularly in this instance, America, need to learn to respond to the next health crisis, the next pandemic when it comes along?
Yeah, we have to make it nonpartisan, right? You look at, for example, a country like the United Kingdom, where they had a review of their COVID protocols and what they did done through a nonpartisan judiciary process. They put out reports. We need something where, when the next event does happen, it's not something that's, one physician or one head of the CDC, making that decision and all the blame and everything being placed on that person, but a nonpartisan way to communicate that information, which was done in my opinion, but unfortunately, that became politicized. Dr. Fauci obviously served under both President Trump and President Biden. So he was someone who was not partisan, working with both sides of the aisles, trying to get good scientific information out there. But I think we have to hold our leaders to account as well. Those leaders that, try to politicize healthcare for reasons that, are unfounded. They need to be called out on that as well.
Great speaking with you. That's emergency medicine physician Owais Durrani in Houston, Texas. Thank you so much.
Thank you.
We'd love to hear from you now. What do you make of the contempt vote against Anthony Fauci? And how has the pandemic influenced your views about public health? Let us know in the comments. If you like this video, hit the like button and don't forget to subscribe to our channel as well. I'm Jared Reid in Berlin. Thanks for watching. See you again soon.